Hello and welcome to The Virus. I'm Jeremy Fernandez. Residential aged care providers say they could be about to experience their worst COVID wave since the pandemic began. There are now outbreaks in 857 facilities. More than 5,000 residents and almost 3,000 staff are infected. We're only halfway through the year and already more than 2,000 aged care residents have died. It's a similar picture elsewhere. The virus is spreading rapidly. The number of new infections, hospitalisations and deaths are on the rise. Let's bring in our analyst, Casey Briggs. Casey?
Well, let's start with a look at the case detection figures around the country. A week ago, it actually looked like this curve might have been starting to slow down somewhat. The rate of growth was lower than it was the week before. Unfortunately, this week, they've started shooting upward again. At least case detections have more than 47,000 cases being reported around the country at the moment. And the curve is really going upward in all states and territories bar two, Canberra and Tasmania. And it's good to see the numbers coming down in those two because that's where the most cases per capita are currently being detected. And the other state I'll just briefly mention is New South Wales, where we actually saw a bending in the curve last week. The case numbers actually started to come downward. That has unfortunately reversed, and we're seeing case numbers increasing again there, more than 13,000 a day. Now, hospitalisations are about 5,300 across the country right now, and we are seeing deaths trending upwards. We're seeing about 65 reported a day at the moment across the country. Now, deaths occurring are definitely going up. It's a little bit difficult for us to actually work out the trend of how many deaths are occurring each day at the moment. And that's opposed to how many deaths are being reported. And the reason I say that is a few times this week across multiple states, we've had delayed reports of deaths. That is, states have reported some deaths that have happened in previous weeks or perhaps even earlier that are only now coming through the state's deaths registry system. So while the trend line is going up, it's a little bit hard to know how much exactly is happening this week and how much of that is kind of related to the delayed reporting of deaths. But it is obviously still a significant number and it is increasing. And Jeremy, we're talking about aged care at the moment, so I want to share with you some data from the Federal Health Department. This is the weekly number of people reported as dying with COVID across aged care residents nationally. And you can see it's a little bit out of date, but in the week ending 14th July, 132 deaths were reported among aged care residents, and that makes up just shy of 40% of all of Australia's COVID deaths in that same period, and that is the highest that share has been since way back in January with the Omicron wave that we first saw in January. Jeremy, the pattern in this COVID outbreak is, this COVID wave is similar to what we've seen in previous waves. It spreads quickly through younger, healthier, working age people across the entire community. And as that wave then builds, it takes a little bit longer to make it into aged care where outbreaks form and we see the consequences. And unfortunately, we're seeing it making its way into aged care in a significant way now.
Casey, thank you. Now, older people have always been considered a high-risk group. Joining us now is Professor Vasi Naganathan from the University of Sydney, a Fellow of the Royalist Australasian College of Physicians and President of the Australian and New Zealand Society for Geriatric Medicine. Professor Vasi Naganathan, welcome to the program. How worried are you about the degree to which COVID is present in the aged care system right now?
We're very worried, Jeremy. We know that it has a big impact on people living in residential care and the staff. And it is a concern. We hope that the high rates of vaccinations mean that we won't have the same level of impact that it had earlier in the year. But if large enough numbers of people are affected, then we will see a bigger effect. And that's what people are talking about, that the biggest impact through the whole pandemic may be during these few months.
So people are vaccinated now. At the same time, restrictions are loosening. To what extent do those vaccinations and boosters offer protection for those people who are in aged care?
They're probably the most important protection. I think Australia-wide, at the moment, the latest figures suggest 75% of older people living in residential care have had the 2 standard vaccines and then the 2 boosters. So that's 4 vaccines. So it's at 75%. And that's probably the most important protection from people getting seriously ill. But that 75% is an average. And what we know is that within facilities, there is quite a bit of variation. So there are facilities that have got much higher vaccination rates, and then there are facilities with lower vaccination rates. So the most important thing is to have that full vaccine rate as high as possible in as many people as possible, and a high proportion in all residential care facilities.
We have seen restrictions gradually loosening. Do you think there's an acceptance that more people will have to die in exchange for the freedoms more broadly in society? And is there a number on that? How many deaths is the system willing to accept?
I mean, I really wouldn't look at it that way, right? I think that's not the way to look at it. The way to look at it is, how can you get the balance right between giving people as good a quality of life as possible in residential care and keeping them safe? So I think the measures of vaccination are important. Then, as Kerry Chandler, I think, spoke on your program last week, the measures of making sure that people and staff, so visitors and staff, don't enter facilities if there's any chance they've got COVID, that they're checked, and that the personal care and protection methods continue. So I think we'd never look at older people that way and go, right, we're going to accept this number of deaths. And we don't do that for any other group in society. So I don't see why we would start putting a number of how many deaths we're going to accept. I mean, we don't do that about any other group. It would be wrong to do that about older people.
At the same time, the numbers clearly are going up. How easy is it for individual providers to police these measures themselves?
I think what you'd find, though, if you speak to both the residents and the family, the majority of people are supportive of the measures they put in place. They're supportive because it's their loved ones in there. So I think if you were to speak the one group of people who do in general understand the importance of this, it is the families of people who live in residential care, because they've been worried about this from the time the pandemic began, and they've been living with this along with their loved ones in nursing homes. So I think the majority of people are on side with this, and I think we can expect that they'd follow the advice and comply with the advice of the providers.
For the families who are watching these worrying statistics come out, those with loved ones in aged care and disability care too, what should they do in response?
Well, if we went through it sequentially, they should encourage their loved ones to be vaccinated and fully vaccinated, because often the older people haven't got capacity to make those decisions, and therefore are reliant on their loved ones to make those medical decisions, because vaccination is a medical decision. So that'd be the first thing. It's important for they themselves to be vaccinated. And then it's really important that they're vigilant about the chances of them coming in with COVID themselves. So if they've got any symptoms, then they should definitely not go into the nursing home. They should follow the advice, which I think is 7 days or even 10 days after they've had COVID. They shouldn't go into a healthcare facility or residential care. And many of the facilities will require them to have a rat test as part of their protection plan, and they should follow their advice. They'll also be giving advice. They've got to wear masks, and they'll probably be giving advice about where they can congregate and to avoid going into the big communal areas. So I think it's really important to follow the advice of the people and the staff working in residential care.
Professor Vasi Naganathan, great to have you on the program. Thank you so much.
Thanks very much, Jeremy.
So to what extent should we be wearing masks, and how much would that do to slow the spread of the virus? Associate Professor Holly Seal is an infectious diseases social scientist at the School of Population Health at the University of New South Wales. She joins us now. Thank you for joining us on the program, Associate Professor Holly Seal. To what extent do we need masks right now, and in what particular settings?
Yeah, just like what we were just hearing before, masks are one of the tools within our toolkit. So it is about ensuring that we are up to date with our vaccines, whether that is your third dose or whether you need to have a fourth dose, making sure you are taking a RAT test if you are going to be going where there are vulnerable people, obviously staying home if you're unwell, and then obviously putting on that mask. It is time that we are starting to use them again, in areas where they're beyond where the requirements are, places where, people are congregating, it's busy, maybe ventilation isn't as great. Those are the times when we need to use it again.
A lot of that relies on self-regulation, people policing their own wellness, how they practice social distancing, mask wearing. Clearly, it's not working as well as we would like because the numbers are going up. What is it that people are uncomfortable about? Why is it resulting in these numbers?
We've always had challenges around some of these measures. We're asking someone to do a practice that, we haven't culturally had, before. And yes, fine, we've been using them for the last couple of years, but that doesn't mean that we're necessarily going to continue wearing them when we don't have, that kind of mandate in place. So it is now getting people to reflect again that those numbers are going up, that COVID is certainly circulating at a higher level in our community again. And that, yes, people may have received a vaccine within the last month or so, but that actually doesn't stop them needing to wear a mask. And that's where there's a lot of confusion around. People thinking, oh, I'm vaccinated, which is great, but that means, I don't need to wear a mask, which is not true. We also know that there are people out there who've had, a recent case of COVID, and whether or not that negates them from wearing a mask. Again, we want everyone to be putting on that mask, regardless of whether or not you had a case of COVID, in the last 6 months or so. We need to be wearing it as a community.
There seems to be a bit of a fork in the road in what the health experts are calling for and what politicians are willing to do. Why is there that disjuncture?
This junction, we've crossed it so many times, around all of the different lockdowns and around the other types of requirements. And so it's not surprising that we're here again. And, we are coming into this with different views. Obviously the presidents of the Australian Medical Association and other bodies, they are looking at rising hospital levels and also staffing, concerns that there is pressure on clinical settings. And so they are responding to that, and then on the flip side, we have the politicians who maybe feel that they are listening to the community and possibly reading a so-called fatigue from the community that, there isn't the appetite for any stronger measures beyond just, putting out that, that recommendation or encouragement for people to wear a mask.
With your expertise in mind, how do you sell that idea of perhaps being seen as regressive, going back to the bad old days of the middle of the pandemic, when people feel like they're ready for a change and ready to move on? How do you sell that idea that, look, this is not over yet?
Yeah, it is being a little bit of a marketer and a bit of a seller. We do need to remind people that this is going up. We are seeing these trends internationally too. So Australia is not alone, that these subvariants are doing, different things to what we've seen to date in this pandemic. And that, yes, we've got, good vaccine coverage, and that vaccines do a great job in terms of severe outcomes, but they only do a moderate impact when it comes to transmission. So no point holding out right now until these next generation vaccines come along. Get this vaccine going, go get your booster, but also then time to trade up your mask. And so, we're seeing a lot of people in the community still hanging on to their cloth mask. Lots of research has been done to show that, wearing a cloth mask is good, but there's certainly a spectrum around the masks. And so if you can get your hands on one, time to kind of, go up the notch to either a surgical or to a respirator, and maybe to park that cloth mask.
And that is the show for this week. From all of us, bye for now.